start a live soon, right?
Ready, 3, 2, 1, you're live.
Hi everyone, it's Danielle. So we are using Morpheus 8 today. This is the big brother of Fractura. So there's a couple key differences. This device has automated needles, so when I step on the foot pedal, they project and deliver energy. Because they are self-propelled, I can actually adjust the depth of penetration. So there's a setting for periorbital around the eyes, face as we're treating right now, and then body. And so the reason that that's important is because you have a lot more control over the depth of thermal injury basically, and how much tightening you're getting and in what layer. So for our patient, he had very prominent acne scars, and they have tightened up tremendously. Aside from just his acne scars getting better, his neck has tightened, his family thinks he looks younger, now they all want to come in and catch up, but we're able to use all these different depths in his single treatment to really maximize the area. So, we use something for around the eye, and then we are able to penetrate the thermal range to about 4 or 5 millimeters in areas that he wouldn't mind reducing the fat a little bit or getting even more dramatic tightening. So we have our energy pretty high. It is set to 32 right now. And so those joules correspond to heat in the skin, and the heat is what stimulates collagen and elastin and everything to tighten up. So you can see that there's a little bit of pinpoint bleeding. That is totally normal. Just because we are able to penetrate into the papillary dermis, we get a little bit of that pinpoint. And we did none topically for it. We are using ice and the Zimmer to make it a little bit more comfortable, but all in all, for how dramatic the results are, it's a very easy, quick office procedure that gives you a lot of results, whether it's just tightening for anti-aging or for acne scars.
What is the downtime like?
So downtime varies person to person, and also kind of what they feel downtime is. I would say that downtime for this is about 3 to 5 days where you're a little bit red, have a little bit of kind of like the pokey imprint on the skin from where these little needles are actually inserting into the skin. And then those little tiny needles or the poke marks turn into baby scabs that flake away. Typically it's about a week. Even with this very strong treatment, I'm going to go back and you can see a little white spot where we missed. Even with this strong treatment, most patients say it's about a week, but not a week where you're hiding out like a CO2 laser. It is a week where you just don't look quite as you normally would, but you're not hiding out by any means. How long is your downtime normally?
3 days.
3 days. Yeah, so you're just a little bit red. The day of, you have some heat that's in the skin. We here use aftercare and some cold mask after treatment to take the heat out of the skin. It cuts down on downtime. It makes the patient more comfortable. And typically 3 days is all you need.
Can you start your skincare same day?
There are some skincare items that you can start same day. When we are doing this type of treatment, we are in fact just using skincare that's going to heal, repair, and soothe. So it's a lot of hydrators, a lot of growth factors, things that are kind of great long term, but they will definitely add moisture back into the skin and start to calm things down. We're going to switch your ice. Go ahead and turn.
Can you combine this with a laser treatment?
Yes, he's answering for me. So you can combine this with laser. RF is not a laser. It's a different energy type, and so what we're doing when we combine other modalities is we're stacking them either different technologies, whether it's a light therapy like IPL or a laser like Fraxel or Clear Brilliant. We can combine all of those with radio frequency, target different depths of the skin, and really maximize this one treatment. So for him, you know, if he had some brown spots or a little bit of redness, we could do a vascular laser to kind of calm down some of this redness, and then do the radio frequency. I'm going to just change my setting, and then do the radio frequency for the scarring and the tightening. So yes, you can absolutely combine them.
How often can you do this treatment?
This one we do about every 4 weeks. Depending on the setting and what the goal was, you could do it a little bit sooner, but 4 weeks is a good amount of time to kind of allow the skin to recover, allow it to turn over. I always feel that at the 3-week point, your skin is looking amazing. It's like it's gone through its initial healing phase. That first week, the second week, it's just really kind of pulling itself back together, and by that 3rd week, everybody is complimenting you. So I love it for the monthly maintenance or monthly corrective when you have an actual concern that you want to improve.
What does it feel like?
What does it feel like?
On a scale of 1 to 10, I'd give it a 2.
That's pretty good. I'd say it's like with a good numbing, it's like a 4 or 5. Some areas are worse. So the way that this works, you feel the needles penetrate through the skin, but you're numb, so the needles aren't that bad. But then you feel a little bit of like a contraction, and that is the radio frequency sending out energy and causing the collagen to contract and tighten in the skin. So there's 2 different sensations associated with it, and it doesn't really feel like anything else. It's not the best, it's not the worst, it's totally manageable, and every patient will tell you it's worth it, no matter what.
Can you go into the sun after this?
Yes, I mean, you can't avoid it here in SoCal, except on a cloudy day like today. You can be in the sun. You should never be accumulating sun exposure. It's just not good for your skin. You are going to be more sensitive no matter what after a laser treatment. So sun protection is super important. But the sun is one of the things that you should always try to avoid because it really contributes to pigment in the skin. It contributes a lot to lines and wrinkles, and it can worsen scarring.
Can this give you skin tightening?
A lot of skin tightening. What did your sister say to you?
She thought I'd lost another 10 pounds.
Mm-hmm.
Wow.
But I always say that the face heals. Go ahead and face upward. Perfect. Stay right there. The face heals very quickly after a treatment like this. The neck and the body heal a little bit slower, but the neck is always the place that gets the fastest tightening out of all the areas. So when people treat face and neck, like the neck perks up very quickly and it improves really well. I'm going to treat your lip. It improves super quick, but those little kind of like sandy scabs last a little bit longer. That's the only thing.
If you have lip fillers, can you do this treatment on top of your lips to maintain the plumpness?
Well, when we do, I would say that the best benefit out of this being used on this upper lip portion is that this is an area that is going to lose volume just like anything else. When you age, your lips lose volume. This starts to turn inward. And so what it does, I'm using you as an example, it elongates this skin right here. And this distance between the lip border and the nose isn't what it used to be. So by using a radio frequency treatment on this area alone, you are going to minimize the development of fine lines. And you're going to keep this nice and tight so that it keeps your lip border elevated. And as far as filler goes, it will not dissolve your filler in the lips. I would say that indirectly it would contribute to making your lips look a lot perkier and just fuller. So yes, I would say bottom line. Make it your nose, okay?
If you did this along the buccal region, can you see some kind of contouring?
Yeah. So actually, the patient I talked about this prior, one more. We were saying that if we set this to a, he's got thick skin, he's got some fat right here. If I set this to a higher setting and I targeted right here, I would be able to have some thermal effect on this fat, which would give you some contouring. So we did discuss that. That's a great question. Okay, so I'm gonna put this on this side now. And do you want to grab some fresh ice packs?
Yes.
We're gonna move on to the neck. Changing our settings. Okay, perfect. So technique on the neck is a little bit different. There's a scooping technique. And it's a lot more comfortable. Typically. How are you feeling? Are there any other questions? No?
Can you do this on other areas of the body?
Yes, that's a great thing to talk about. This is going to give you skin tightening, a little bit of fat remodeling. So this has become one of my favorite treatments to incorporate onto body areas such as the abdomen. You can use it on the chest for tightening to reduce the lines on the décolleté. You can also use it above the knees, on the arms, inner arms, for the crepiness that you get when you start to bend your arms. And my favorite, the banana roll. No one likes it, and a lot of times it's fat and skin laxity. And with a treatment like this, because you can set it to a body setting and penetrate the heat to 5 millimeters, you're really able to tighten that up and target the area completely. So you're getting the 2-in-1 benefit of skin tightening and the fat reduction.
How many sessions are needed to see improvement, or how many sessions did you see improvement in?
How do you feel your improvement went from being treated with Infini, the results being treated with Fractora, and the results being treated with Morpheus?
The big changes were with Fractora and Morpheus.
So because those penetrate a little bit deeper, you get more tightening out of them. And you know, a man has thicker skin, and a man who has acne scars is going to require deeper energy than a woman or someone who just wants a little bit of skin tightening, or someone who has thinner skin. It's just the way that the anatomy differs. But with this, you know, you're able to really target and specifically cater to each person's unique attributes, their skin type, their concerns. And as far as how quickly you see results, even with one treatment, you're going to see a change. When you have severe acne scarring, it's not going to be a one and done by any means with any modality. As far as just starting to see the effects, when you see the pores shrinking and you see the lines improving and you see the tightening happening, I think that happens in about 3 weeks, even just after your first treatment. To really get some great results for anti-aging, I would say you're looking at 3 or 4 3 treatments. For scarring, you're looking at 3, 4, 5, 6 treatments depending on the severity. Go ahead and turn the other way. Thank you.
Is it safe for darker skin types?
Yep, it sure is. You know all the information. This is great. It's safe for darker skin types. These needles are gold coated, so they're fancy and safe for every skin type. Fancy. You can't see them, but they are gold, and the very tip of these little needles are the only parts of it that release the energy. So it's as if you had this entire finger coated, and only at your fingernail was the energy coming out. So what that does is it spares the surface of the skin. The surface is where your melanocytes are. It's how your skin responds with pigmentation to the sun, for example. So when we're not traumatizing or causing heat in that surface layer, and we're really just digging deep into the deeper parts of the dermis, it creates a very safe treatment for all the skin types. And with that, I would say that we still, even with safer needles and safer technologies, with dark skin types, we still take that added effort to brighten the skin beforehand or incorporate brightening skincare just to reduce the risk of any form of PIH. You only want to get better results and minimize the risk. So we do that. It is safe, but you can go into this treatment without any skin bleaching or pre-treatment.
And it's safe for people with melasma, right?
It is a safe treatment. For skin tightening, we do a lot of other lasers as well that we kind of use more to treat melasma. as far as that goes, you can use this for some skin tightening in the area, but then for melasma treatment, we use a lot of Clear and Brilliant, Aerolaze, and chemical peels. What other questions do we have? Is that it?
I'm trying to think of any if I have any. How are you feeling now on the neck?
It's easier than the face.
Oh, nice.
When you're good and numb, some parts of the neck are like a little ticklish. I don't know if you would call it that. But you can get a nippy one every now and again. But for the most part, it's pretty comfortable. Alright guys, well I'm going to finish up here. We are almost done. He's been awesome. He's gone through this treatment a couple times now and his skin has smoothened out so much. You know, we'll see how he's doing after. I'll show you kind of what we do to calm the skin after the treatment. Thanks everyone.